everybody. I, Dr. Trupti Pai, Coordinator at National Institute of Clinical Excellence, request the Secretary of NICE Institute, Dr. Shilpa Satish, to start the session.
Thank you, Dr. Trupti. Hearty welcome to all of you for this orientation program of Batch 7 PG Diploma in Advanced Classical Homeopathy on behalf of National Institute of Clinical Excellence. Warm welcome to our dear faculties, Professor Dr. B.D. Patel sir, Professor Dr. Shripad Hegde sir, and Professor Dr. H.L. Swami sir. I am delighted to welcome all of our dear homeopaths who have joined today's program from different parts of India and abroad. We can see many new faces amongst our known faces of NICE alumni today. Thank you all for joining. I'm very happy to welcome our core committee members, Dr. Trupti Pai, Dr. Anusha Matthew, Dr. Neha, and Dr. Antara. National Institute of Clinical Excellence aims to bridge the gap between the class and clinic, thereby promoting the practice of classical homeopathy, which aids to create a healthy and strong society through homeopathy. Our courses, PG Diploma in Advanced Classical Homeopathy, PG Diploma in Thyroid Disorders and Diabetes Management, helps us to reach our aim. Meanwhile, we do conduct short workshops under the banner Class to Clinic webinar series, Homeopathic Dermatology, Mastering the Significance of Intercurrent Remedies in Clinical Practice, Rare and Uncommon Prescriptions, Hidden Treasures of Plant Kingdom are the few to mention. Year 2023 is special for us because we celebrated our decennial function this year. A national conference was arranged by the Institute under the theme Role of Homeopathy in Women's Health. I'll now just take you through the tentative schedule of the next 6 months of the course PG Diploma in Advanced Classical Homeopathy. The entire 6 months will be divided into different modules. Each module will have a couple of sessions. Each session will be of 2 hours. We will be starting with case perceiving module, which will have 2 sessions, understanding the patient, not just disease, picking up the diamonds from the dust, which will be followed by repertory module, which has 4 sessions of 2 hours each, which includes art of repertorization, understanding the utility of therapeutic pocketbook, mastering the repertoire of homeopathic materia medica, scope of Boger-Bonninghausen's characteristics and materia medica, utility of clinical repertories. Materia medica module, we will have how to study materia medica, and one remedy from different kingdoms will be discussed in the entire module. We have exclusive module on miasms, where we will deal with history and mystery of miasms, chemistry of miasms and Stalwart's view on miasms, miasmatic mapping of the case and a remedy. We have entire module dedicated for intercurrent prescription. Topics will be role and importance of intercurrent prescription and other 2 sessions which will follow the same. In the practical organon, we have more on constitution, temperament and diathesis, analyzing the follow-up visit and enigma of doses. We have case discussion module where we will have 3 sessions entirely dedicated for case discussions. The last module will be acute case management, which will be followed by a session where all faculties will be there to answer all your queries. Meet our faculty, Professor Dr. B.D. Patel sir, Professor Dr. Shripad Hegde sir, and Professor Dr. H.L. Swami sir, who will be there with us throughout our journey. We, the coordinators at NICE, myself Dr. Shilpa Satish, Dr. Anuradha Vishwanath, Dr. Trupti Pai, Dr. Anusha Matthew, Dr. Antara Chatterjee, Dr. Neha Dwivedi will be there at any time to help you out. In case of any queries or clarifications, you can always reach out to us to our office number. You can write email to us. Please check our website www.nicehomeopathy.com for all recent updates. Thank you.
Thank you, Dr. Shilpa, for a brief introduction about how the next 6 months is going to be. I now request the founder, director of National Institute of Clinical Excellence, Professor Dr. H.L. Swami, to enlighten the participants regarding the next few months.
Thank you. Thank you very much, Dr. Trupti. Here, first thing what I wanted to tell you is, see, you cannot learn homeopathy in 6 months. Okay. So what here we give is, here we are making you the practical utility of what you learned for 5.5 years. So it looks, some titles, some this thing looks similar, already you know this thing. But we wanted to keep those titles because so that you are already familiar with that names. Okay? We are not going to talk the things what already taught you in your BHMS. We take from there to the your clinic, practical utility once you sit in front of the patient. Okay? And this is the only beginning of that journey. We are orientation towards the classical homeopathy. Okay? And this journey will continue. It is not that within 6 months you will be masters, but at least we are giving you the idea about this thing. Okay? So, can you put the slides?
Yes, sir.
For us, what is this interesting here?
Observation.
Unmute and talk. Yes, Praveen.
Mahesh Babu's observation, sir. Keen observation.
Acha, good. Observation. And smartness. Who brought? Good. A skill of observation. Okay, sound sense. Then, see, first time he saw the screen guard. Second time, he hit that one. It is not that what already, once it is success, same thing, same should be repeated for next time. Not necessary, isn't it? Each case is a new case. Same drug or same application or same interpretation may not be useful in the next given case. Maybe the same thing, but it is not necessary to be the same, isn't it? First, he opened the screen guard because there it was not, that is necessary. Second thing, he could take that risk. So it's not that every case it's only by mind. Only mind symptom, all the cases is solved. So sometimes the causation, physical constraint, past history, family history, you may get the link anywhere, isn't it? So that is somebody put as a right word, smartness. Smartness. And second, this thing is, it is not that what you see. Seeing, it is more than what you see. That is where it is called as, she put as a perceiving the case. You have to perceive the case. You have to look behind what it is seen. And keen observation. So by the tag, he identified that 3 people are working in 3 different companies. In clinical practice, that is very important. Keen observation. It is just not just the listening, passive listening. Listening, observation, and right interpretation. It is not just the for everything you interpret. No, it should be right interpretation wherever it is required. Isn't it? That video showing the same thing, no? Good, very good, good. Next part.
Yes, sir.
Neha?
Yes, sir.
It is there or over?
Sir, I think it's over.
Just we see is the right, this thing. Sometimes you have to cross-examine, especially in the follow-up cases and all, follow-ups and all. Lot of times, patients, so even though they are improving, they think that moment I say improving, doctor may not give only placebo. So they keep on telling no changes. So how are you? Sorry, it is increase or no change. you keep on asking each one, then they will start revealing where exactly this thing. So you have to go behind these words. Actually, it is not what they talk, how they talk. That also makes the differences. This observation is very important. Okay. Next slide. So the course name by all this time already you know, it's a postgraduate diploma in advanced classical homeopathy. So our motto is to prepare you homeopaths for a successfully handling the cases. Okay. Next. Neha, can you read it?
Yes, sir. For whom? Any person who is interested in well-being of society at large and her or his patient in particular.
You got it. So this is for the people who are has a genuine interest to serve the society and the patient. Yes.
Who want to promote the sick-free society with minimum medical interference.
This you are going to learn even in the course, that not that every time you have to interfere with the medicine. Patel sir is very good in that one. He keep on telling how your lifestyle, your food, your even the talk, okay, and the how the dress, all that also has the implication, not just only every time, it need not to be only with the medicine. Okay.
Who wish to make man healthy in all aspects.
Okay, good. Next.
Who want to make use of homeopathic medicines in handling all types of diseases.
So where here we are exposed to the different types of cases, all types of acute, chronic, different sphere of actions, okay, different system, all that you are going to see the cases. Here we are almost, you are getting more than 100 years of experience for you. Patel sir himself has around 50 years clinical experience. Hegde sir has nearly 40 years of clinical experience. Okay. So I'm the junior. I have around 30 plus years of experience. All this around 100, 125 years of experience you are getting in these 6 months on handling different types of cases, what type of cases needs what type of applications. Okay. All that one here we are going to give you in this course. Okay, next.
Who aims for single remedy, minimum dose, and to cure all curable cases.
Okay, at a given time, one remedy. That is our motto. At a given time, one remedy. Okay, and as minimum doses. Minimum dose doesn't require need to be only one dose. It is not that. It is a minimum dose. According to the case, that minimum dose may vary. Okay, and to cure
all curable cases.
All curable cases. Okay, it is not that we can cure everything under the sun, but all curable cases we can cure. In other cases, at least we care. Okay, care, palliate, okay, and give the comfort, the best comfort.
Why nice? Homeopathy is an art or science?
So tell me, homeopathy is an art or science?
You can unmute or write in the chat box, all of you.
Both. It's art as well as science.
Yes, it's art as well as science. Okay, both.
Medicine
It
in
is
general.
basically a science with artistic application. It's a strong science based on the science, where a physician A good physician, he can make it as the best art. Okay? While application, he should apply the skills and make it as an artistic. But this foundation is very strong and it is a science. Okay? Yes, art of case taking. Case taking, correct, art. With the scientific background.
Science of prescribing.
Good.
So should I read?
I can read, no problem. Medicine in general and homeopathy in particular is a dynamic science like a quantum physics. Okay? See, whereas other medical sciences are there, science is restricted as a mathematical science. 2 plus 2 is 4. So in medicine, mathematical science will not apply. Here it is a flexibility. Flexibility. That's why I told it is more like a quantum physics. It varies from individual to individual, person to person. In medicine, 1 plus 1 need not be always 2. It may become 99 also. It may become 6 also. You got it? Huh? To understand the man in health, in disease, and the foundation should be very strong. Okay? To understand the man both in health and disease, your foundations should be very strong. That's where we give the strong fundamentals in our institute. Proper understanding of organon, metromedica, and repertory is a key for clinical success in homeopathy. See, our all prescription will be based on organon. We may not here teach you the aphorism numbers. We will not teach you. We will not tell what is 141 aphorism number and by heart. No. We will show the application of it. Our prescription should be based on organon. Knowledge of metromedica is a weapon. And how to apply, when to this thing, which weapon to select, repertory will help. These three are the foundation and strong. If you are good in these three subjects, you will become a very good homeopath. Okay. Next. So already you learned. It is not that we are, as I told you, we are not going to teach you this thing, BHMS syllabus. What we are doing is from knowing to unknowing. We have, see, he has the tool, but he doesn't know how to use it. Even that tool is enough to climb the wall. But he is using multiple of the ladder as like a stone. This is where it is not that what we have, we should know how to use and when to use, which way. That is important. That's what it has to be trained. Your clinical aspect, when to use which medicine. Otherwise, in metromedica, if you read sulfur, in sulfur itself, all the disease of mankind can be cured. First time when I studied red sulfur, I thought, oh, I have most of the symptoms of me is in sulfur itself will take care. It is not like that one. So we should know when to use sulfur, when not to use sulfur. You got it? See, the basic difference is when penicillin came, people thought that it is a Sanjeevani. All diseases can be cured with penicillin. Or antibiotic you take nowadays, antibiotic. A less qualified person use more antibiotic. Well-qualified person use antibiotic only when it is required. Really skilled person knows when not to give antibiotic. Same way, you should know when and how much you have to use it. Next. This case, no, don't jump this case. Okay. So case again, it takes more time. So let us, okay. So already Dr. Shilpa told what are the syllabus we are going to cover. So in that next 6 months, again in brief, I'm just explaining you. In the first module, it is pursuing the case. It is not just case taking. It is understanding the person or a patient behind the disease. So you all know, as a Kentanians, it is not the disease we are going to treat. It is the sick person is more important than the disease. Okay, this we are here, we give more importance. As the patient comes walking through your clinic, your case starts there. That's how even our modules are designed. We'll not teach you first Mitra Medica. We'll teach you first the art of case taking or the perceiving the case. Okay. Next, it is not just only listening. You should have the observation. Already in that video we showed it is different from passive listening to active observer. And out of the so much of information, how to pick the right information, picking the diamond from the dust. So much of this thing was there, but what they picked to uncrog the case in that one, like that one, even in the given case, you should know. Otherwise, they will give you almost around 5 to 6 pages of symptoms. Out of that, you should know which one to pick. That the more nearest the symptoms which is near to the core of that person you pick, your prescription will be much better. Okay. Next. Then after taking the case, what we'll do? We'll analyze, synthesize. It is not that all the symptoms what the patient give we cannot work out with the repertory. You have to convert that into the rubrics. This art of converting symptom into rubric is also a big challenge. Okay. So many times, what is there in repertory, you will not get it in the case. What is there in the case, you will not see in the repertory. So patient comes and tells that tandoori murgi, he desires strong desire for tandoori murgi. Which repertory you see tandoori murgi? Isn't it? So you should know how to convert the symptom into rubrics. Selection of right repertory is also very important. Which repertory? There are so many repertories are there. Which repertory to select when? Okay. And on the basis of the different ideology like Boninghasen method, Kent method of repertorization, Boger's method of repertorization. And if you know the basic science, on that basis, it will be easy for you to select the repertory. Which repertory should be selected for which this particular case. Okay. Next. Mitra Medica, which is very crucial, more important for a homeopath. You should know how to read the different Mitra Medica. Okay. Lot of people do the mistake when you try to see more mental symptoms in boric Mitra Medica. Isn't it? Or you try to see the pathological names, disease name in Kent Mitra Medica. So you should know which Mitra Medica to read for what type of case. Okay. And understand the drug through the kingdom. So from each kingdom, we will one drug we will be this thing, so that you can understand it how to read the Mitra Medica on different context. Okay. Next. One more enigma or debatable topic or confusing topic is miasm. So here we are giving as much as possible. They try to give the clarity about the miasm through the history of the chronic disease, history, mystery, and chemistry of the miasm. Next, understanding each miasm in detail, both in the picture wise and clinical wise, both the way. Okay. Next is intercurrent prescription. What's its role? in regular homeopathic practice, what is the role of intercurrent, when to use, how to use it, okay? Which are the remedies should be considered for intercurrent prescription? Is it all the remedies can be used as intercurrent? All that clarity we will going to learn in this module. Okay, with cases. Okay, where and when it's possible, we'll give the with case examples with cases. Next is second prescription. So somebody told it is very easy to give the first prescription. Both patient and doctor is happy. Doctor is get the fees, patient get that. He got the new doctor and new home. All problem starts only when they come next time. Follow. So how to handle, including the understanding the apart from the second prescription. In this module, we are going to understand the constitution, temperament, and diathesis, analyzing the follow-up visit, okay, and posology. So this is also one of the lot of debatable topic. When to use which potency? Why only that potency? Why not this potency? Is it you should stick to one potency for all cases? All that one we are going to discuss in detail in the posology section. Here, in the case discussion, we are going to demonstrate either the closed cases or the live cases. Okay, so according to the availability, if the live cases are there, we will allow you to take the case, work out, and follow-ups, and what are the things should be considered, what you consider, and what your faculty thought, this thing, how he does. So all that discussion will be there on the case basis. So analysis, repertorization, prescription, and why this prescription, why these rubrics are selected, what is the analogy, all that we are going to discuss with all the faculties. They will bring out their cases and show the cases to make you more clarity about the understanding the each and every case when you sit in the clinic. Okay, and discussing the cured cases, interesting cured cases. Okay, and last is the acute disease management. Most of the time, your success of your practice depends on the how you handle the acute diseases, isn't it? So how fast you give the recovery, how fast you give the this thing in the acute condition, that makes you your success in the for the public. They only know that immediate results when you give that. How to manage acute diseases with a minimum sometimes cases come with a minimum symptom or no symptom, even including that type of cases, how to handle. And with all in this module, we will also discuss about the some rare remedies also. Okay. Okay. Thank you. If any questions. So in brief, I took you to the journey of how it will be your next 6 months is there. If any questions are there, let me know. So this is what we wanted to, at the end of this thing is, the purpose of learning is to become an independent. Somebody can read. Last lines I cannot read. Shilpa? Independent thinker, not a mindless follower. Okay? So this is what we just don't follow somebody told just this thing. You should be independent thinker. So that is what our Dharma also says the same thing. You have to think independently. It is not just follow this thing. Okay? So same thing with homeopathy. You have to question why and think. So the cases where I may not success, you may give the better treatment because you think in a different way. So we wanted you to not a copy paste type of person. We wanted to make you as an independent thinker. In Bombay word, hatkar. Hatkar, you should think in different way. Okay. Thank you. Thank you very much. Any questions?
So thank you, sir. Thank you, sir. We will take the questions a little later.
Okay, fine.
Thank you very much, sir, for enlightening the participants on how the next 6 months are going to be. I'm sure if there are some questions, we will definitely take it at the end. In the meantime, you can also put the questions in the chat box so that we can save some more time. I now request our faculty, Professor Dr. B.D. Patel, sir, to talk to the participants. Patel, sir.
Shumadhyana, once again. Now everything Dr. Swami has talked. Now what will I talk? Whatever my thoughts, words, and he has put it into the words. My thoughts. Bolo main kya karu? Every word by word, sentence by sentence, example by example is that it is. This is how it happens. See, you give me first everything. I will speak out. Then Dr. Swami. Well, friends, anyhow. Now, see, the very important part, Dr. Swami sir has showed that film. I would like you to go and see again. Okay? He has told you the later part. The first part is also very interesting. Now, the hero is called to defuse a bomb in Kashmir. Okay, Kashmir. There, those who have seen, they can identify. So he diffuses the bomb and he sees somebody trying to press the remote control. The fellow wants to blast it. He'll run after him. He'll run, chase. The culprit, the villain or the main fellow who want to do it, because they are Kashmir wear the same dress, there will be one fellow standing there. He will put his shawl and his cover on that fellow's face and he says, "Sir, I have caught him. He is the person." The hero shoots him, not the person whom he caught, but the fellow who is pretending that this is the person who did all this. He will shoot him. His senior, standing next to him, he says, "Hey, how could you make?" He said, "This is what observation. Number one, he ran around when he was running, he stepped in the pool of water, and you see his shoes. One shoe is wet. Number two, when he was running around, he hit the wall, and there is a wall color. You see that fellow? His color is that on that wall, on his shirt. So this fellow is the fellow, not the fellow whom he's showing. This is what we call, everybody sees the case, takes the case. But some people observe carefully and meticulously, and they are able to hit the simillimum. Please see, it's a very nice film. I think I should congratulate Dr. Swami that he has given the example. Please go and see. You can see it in YouTube. Forget about other thing. YouTube open karo and dekho. Hindi mein dekho, Telugu mein dekho, Angrezi mein dekho, Kashmiri mein dekho, kisi mein dekho. Okay, you see, this is what I used to do in my, even now I do. Whenever we see a film, whenever we see a, episodes or TV thing, we see what we can learn from that, what we can pick up, how to observe. This, you will see that how the hero hits the fellow who wanted to blast, when nobody can make out that he is not the person. This is how exactly what we need to learn. And this comes by practice, number one. Number two, you should know the approach. Many times, see, we are in this profession for the last 50 years, and we have seen many colleges, they go by book rule. Always book rule doesn't work. Pustakada badane ka hai, book badane ka hai. This is what Karna they say very often they say. Sometimes you need to think out of the box if the case is not responding. See, take this case, evaluate and repertorize, and then they give the medicine, start with 30 potency, give only one dose, wait for 1 week. These things are taught in the colleges as the regular way. Fine, that's okay. I'm not saying it's not done. But many times, the cases what you get, they are little different. And in homeopathy, now the trend is, and I'm talking of metropolitan cities, big cities, after taking all allopathic medicines, if they don't respond, then they come to you. If it is a village, if it is a remote place, doctor कोई नहीं, चलो डॉक्टर बाबू हमका देख लो, हमका ये समस्या है, हम का करें? That's a different issue. But in most of you are speaking English means you are practicing only in cities, not in villages like me. Okay, so you'll get cases only after getting thrown away by allopaths. So you need to be more meticulous, more observant, and more things. As you know, see, for example, we were treating one case on migraine. Then we said, we took one say, भाई क्या होगा यार, 3 महीने का कोई फर्क नहीं है, अब क्या, what do you mean by this? So we started. Ultimately, it came up that as long as the mother-in-law is in the house, she gets the headache. And the moment mother-in-law goes to her son's house, I mean, summer daughter's house, she's fine. This was told by her husband. And then we asked, क्या बात भैया ये सच है? नहीं डॉक्टर साहब ऐसा कुछ नहीं है, नहीं वो होते थोड़ा टेंशन होता है, वरना मेरी सासू माँ की मैं बहुत सेवा करती हूँ। अरे सारे हिंदुस्तानी सेवा करते हैं, अब मन से करते हैं या बल से करते हैं या भाई मुसीबत है इससे करते हैं, या और बात। So we took that as the main thing and we prescribed, and she was better by 50% in 1 month. Then slowly so it came out. डॉक्टर साहब अभी कभी कभी होता है, जब धूप में जाते हैं तो हो जाता है, जब भोजन नहीं करते हैं तो हो जाता है. All these things she told me. What I'm telling you is, we don't know where we hit, where we get the clue. So you need to be observant. Sometimes you need to be going deep into the case. Sometimes those factors which are not even mentioned, they should be taken. And these things will help you. And this is what you will see with all the faculty members. See, we have faculty are only 3, but you don't know, my friends, new friends, there's a bunch of super faculty who are much more than us. After all, 50 साल बुढ़ा हो गया, क्या बात है? See now, नेहा जी, तृप्ति जी, शिल्पा जी, अनुषा जी, अंतरा जी, all they are very, very well matured and nice cases they will present. They will be your coordinators and they'll help you. And as somebody was telling, you can put your cases also sometimes, and all of us will sit and discuss and let us see how we can help them. Okay. I would not like to take much more because अभी मेरे पास कुछ है नहीं बोलने के लिए. यही है. I wish all of you very happy and nice course time, and also request if possible अपने दोस्तों को ले आओ, ताकि हम तो डूबे सनम लेकिन साथ में तुम्हें भी ले डूबे. Anybody who doesn't understand Hindi? दयाल जी, आपको हिंदी नहीं आती? Yes, so we are getting spoiled, so we'll all get spoiled. But who knows? You may be able to help them to learn what they never imagined. This is what you are going to get in this course. Many cases, it will be straightforward and simple. Nothing rocket science. Everybody says rockets. There's nothing rocket science. It's only simple. Things will be made more easily approachable. And when we present the cases also, each symptom, each case will make it that you will think, I also can prescribe this. That idea we want to give you. It is not that 50 साल का बुढ़ा करेगा. No. 50 साल का बुढ़ा कुछ नहीं करेगा. Maybe Tripti can treat better cases than me. Shilpa is one of the greatest physicians in our faculty. She does wonderful things. And Anusha Mathur, Neha Dwivedi, she's ruling Kanpur. Do you know that? Yeah? तो रक्षा कौल आप कहाँ हो, किस शहर में हो?
सर जम्मू में.
जम्मू में हो? अरे कोई बात नहीं, जम्मू में हमने कॉन्फ्रेंस किया था, हम वहां पहुंचेंगे दोबारा. अभी तो मेरा हिंदुस्तान है ना.
We'll be waiting.
अगली बार मोदी को जिताओ. Okay, fine, this is not the forum, but anyhow, you will have a nice time. Attend all the classes. Don't try to miss. keep these 2 hours whenever the time is given exclusively for this, because you need to learn and you need to teach us also, because many times we learn much more than what we express. Because new people, young people are very dynamic and they can go very fast. Thank you. Thank you, Dr.
Thank you,
Tripti.
sir. Thank you, sir. Thank you very much for your encouraging words. I'm sure all participants will be definitely looking forward for learning from our faculties. I now request our next faculty, Professor Dr. Shripad Hegde, to encourage and motivate the participants and say a few words about the course that they'll be joining. Hegde, sir, over to you.
Shiva Madhyana, very good afternoon. I don't know, see, the many they have joined, and online classes are very interesting, by the same time, very diverting also. And we don't know whether both the years are here only to listen to us, or 1 year is somewhere outside, another only 1 year is with us. And as a medical science students, we need both our ear, brain, as well as mind and heart together to study. That's why I don't know what is the objective of joining this. There should be some clarity. And the overnight sudden miracles may not happen in any course. Now, Patel sir, though he was telling very lighter way, but he was serious about that. Hum doob gaye, abko bhi. Huh? See, it is not like that. See, who is a successful man, he knows the experience, struggle, understanding, and the pain and gain of all this journey of success. Then, how do you say that what is the success then? See, then naturally you say that somebody comes and tell, or with me or Swami sir or Patel sir, sir, we remember your class maybe some 15 years back, 20 years back, or the last year, and we have used that in my practice, and that patient got cured. हमने उसको दवा दिया, उससे उसको काफी फायदा हुआ. See, for that, we get actually our fees back, Guru Dakshina. This is what we expect from the students, not anything else. See, if we have shown some pathway, we could able to give some guidance, we could able to direct them, or if our teaching, that the teaching memory lanes, if they guide us to get success, see, we are more happy and proud about you. And all you have joined may be thinking like that, you want to become a successful practitioner. Am I right? Means, I don't say that now you are not a successful, but you should be more successful and more challenging cases you wanted to treat. Because each and every case is a challenging cases for us now. The society may be a very common cold, you think like that, it may be so many causes behind that. Then, that's why we say the success requires constant hard work and determination. I don't know how many you are ready for that. Then you have to step in, do the hard work. Without that, the cream will not be available anywhere. For that, naturally, we have to work hard. Then only you could be able to get it. Then, I don't know, what is your goal? What is your goal? Fix it and work for that. You want to become a successful homeopathic practitioner, like, for example, now B.D. Patel sir, or in your area, many may be there, many patients may be in a queue, or they are waiting for their appointment, and this, see, that will be a success. And your goal also should be same, I think so. Or you want to learn and you want to earn. So both the things have to go together. Life is like that. That's why life is a canvas. But I say, it is a blank one. It is in front of you now. Create the masterpiece that is in your hand. For that, such courses are needed. See, somebody will guide you. For example, I don't know how many you know how to ride a bicycle, or how to know swimming. Anybody can teach you that? Or can you teach to anybody that how to ride a cycle? You can say that you have to hold both the hands, you have to sit on the seat. वो साला गिर जाएगा, उधर ही मर जाएगा. See, then naturally, but some guidance is required to save their life without getting hurt. See, that job actually where in the nice we are doing it. We guide you how to hold the handle, how to make the pedaling, how best you can sit on the seat and you can ride a bicycle. But before that, you are the rider. We are the guides. That's why you should work hard. If you come towards us 60%, we are with you more than 50%. Then both together you could able to get a success or you could able to reach your goal. And dear students or the faculty, I say some of the you are practitioners, and life is not a competition. You are not competing with anybody. You are competing with yourself to get a success. Keep in mind very clearly. I am very sure that will lead to a more success. मैं उनके जैसा ही बनना चाहता हूँ, नहीं हो पाएगा. उनसे भी अलग more successful आदमी बनता हूँ, तो successfully you are there. That's why use your struggles as an opportunities. Now, some of you or few of you might have joined. I don't know in our entry form whether there is a column something like that why they have joined for this course. I don't know. Otherwise, next time onwards, Dr. Trupti or Shilpa make it a point that we have to keep
sir.
why they are joining. Means, what is their expectation? What is their expectation from this institute or from doing this course? Okay, many might have been referred by someone who has already done this course, or somebody may be giving the idea that no, they are talking about the practical things what we have not seen on in our institutes when we are studying, or in our institute what you have studied or has seen. Maybe a more experienced persons are here to guide us, and we can become a better practitioners. That's why I say use your struggles as opportunities to grow, learn, and become better practitioners. Keep it in mind very clearly. So I said your goal should be very clear. That's why I said don't follow someone. अरे वो तो बुखार के लिए एकोनेट दिया इसलिए कम हो गया, मैं भी एकोनेट देता हूँ, नहीं हो पाएगा. After एकोनेट you may get failure because there should be some base for your prescription, no? वो दिया इसलिए मैं नहीं दिया. अरे वो कोई बोलेगा बॉम्बे वाला नहीं 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 मैं फास्फोरस 1 mg दे दिया फॉर हेपेटाइटिस बी एंड द पेशेंट बिकेम ऑलराइट विद इन 3 weeks. Is it possible? We know the scope and limitation of the medicine. We know the prognosis, diagnosis, and how the physiopathological changes are taking place in the varied diseases. Yes or no? That's why just don't believe in anything. You just try to understand, you get yourself belief in that, then go ahead. Then to achieve, to become a good doctors, such courses usually guide you, help you. And I think the last 10 years, the NICE have done a wonderful job. And totally, I think more than how many students came out, Shilpa? Last 10 years? Those started with the small group.
Yes,
Total
yes.
number of
Sir,
students came.
it is
Huh?
more than 200, sir.
More than 200, 250, they came out. Means naturally they are benefited. And the institute is continuously doing this wonderful job, means we should be thankful to the institute. The NICE is not just an ordinary institute, though looks like that the limited staff, but all the staff are committed. 24/7 they are available, and 24/7 they are guiding you. See, I don't think no institute will do that job. See, temporarily, momentarily coming and going is not the thing. It is not like that. Even after completion of the course, also they are with you. That I think hardly happens in any institute. एक बार कोर्स खत्म हो गया, कोई मुड़ के भी नहीं देखेंगे उधर. ऐसा नहीं है. Here it continues. Even I think first batch students, they are in touch, still in touch with the faculty, and they ask their difficulty, they get clear, and they are with us. See, that is the very special things. This will say, see, what is success or who is successful practitioners? I say, if you are happy, then patients are happy. When the patients will be happy, if your prescriptions are right and correct and to the point, by understanding the patient, understanding the disease, understanding the system, and in the under the system, so many things that I think it takes 5 to 6 months or more than that. See, now the Swami Sir was glimpsing what are the things we are going to discuss. Out of that, many things comes. That is all needed for our practice. See, that we are going to learn in that. And I think you are meeting a different range of expectations. Naturally, your expectation is very high. I can understand. And many you have been practicing for a few years or many years. And you know the practical difficulty, what is that? Okay, by joining this course, our practical difficulties may get solved. I assure you 100% sure that you will get some solution for your problems and whatever the existing things you feel that is a struggling, that is a challenge, that is a tough job to handle such cases. Certainly you will get an answer from the NICE, I assure you, with the very confidently and very proudly. And by the same time, to achieve your goal, my dear students, you need a passion. You need a passion, and you should have a good vision. You should have a good vision, and by the same time, you should have a proper preparation. Make a note of all these things what I am talking one by one. Number one, I said the passion. Number two, I said the good vision. You should have a broad and good vision. Like who said the eagle's eye. However, it is a height, but it could able to see its victim from that. That is a vision, how they concentrate. And that vision is needed for the students or the practitioners. See, patient mein kya dikhna chahiye, what we have to see in the patient. Perceiving the patient's complaint is more important. That's why one should have that. That's more important. And number three is a preparation for that. If your preparation is very poor, naturally you come and sit in the class, it may be not useful. That's why you should prepare yourself to attend and learn better. Then your preparation is needed. And by the same time, dear students, I will tell you, you need a courage to study, to say that I am a student of NICE, very proudly. You should have that. That is very important. Otherwise, you may not able to learn. Okay, then you should have a perseverance. And don't be prejudiced. And out of all these things, not finally, there are big list is there. Dr. Tapti may warn me, sir, your time is over. Huh? There should be a good integrity. Integrity, that is more important. Without that, you may not able to achieve anything. Dear students, out of this, we are all teachers. Patel sir was telling you. See, if we talk hours together. Huh? But still, we are all with you. And I wish you have a good time in the NICE Institute. And my sincere and honest advice, you take it. You tell this information to all your students, colleagues, your juniors, your seniors, who are all willing to join us in the journey of this study. And next from, I think, January, am I right, Trapti? Huh?
Yes, sir.
From the January, this will start up to the June. Huh? Whoever is interested to join us, if they have any practical difficulties to join or anything, certainly the faculty will guide them, and you inform each and every one who is there in India, abroad, anywhere, Australia, or I can say Atala, Sutala, Vitala, Patala, Rasatala, anywhere. Let them join this night, because there is advantage that it's online. See, earlier, I think 4-5 years they were doing equally offline. Now they have advantage. Now I think here from
Switzerland.
From Switzerland, I think the Ashok Madan sir is attending for long period. See, I think this time he will get some more from Switzerland. And I'm going to inform one or two from Australia. They have shown some interest. Let us see. See, I wish you all the best. See,
Thank
you
you,
have
sir.
any doubts here to joining in that, so let us know. Certainly, we are there with you. I wish you good luck. Thank you.
Thank you, sir. Thank you very much for the encouraging words. And as you rightly said, NICE is just the beginning. It is the journey is going for a long period of time.
Nice is just beginning, but don't say nice is just a nice beginning.
Yes,
nice
sir.
Beginning for nice people, for nice doctors, for treating patient nicely.
Okay. Right, sir. Right, sir. Right. So we have two students from Switzerland this time, Dr. Ashok Madan and Dr. Nidhi. So thank you very much. Okay, now we have our faculties have enlightened you all and just shared how the next few months are going to be. I'm sure most of you all who are new to our institute would want to know that how are the experience of our previous alumni who have graduated from our institute and how it has immensely helped them in their clinical practice. As you all know, this is our 7th batch, and with no airs, honestly, all those who have graduated in the last 6 batches have found our courses and whatever we have taught in our courses very valuable and immensely helpful in their practice, and they have really flourished as well. So without talking much high, I would like to hear it from the horse's mouth. And so I request our nice alumni, Dr. Neha Dwivedi, to share her experience being a part of our institute and doing our courses. Dr. Neha Dwivedi, over to you.
Thank you, Dr. Tripti. Namaste to all. Or I'm Dr. Neha Dwivedi and practicing since last 14 years. एंड मैंने 2 साल पहले नाइस इंस्टीट्यूट ज्वाइन किया था और वहाँ पे मैंने DTDM का कोर्स भी किया, PG DTDM, PG DACH का भी किया, जो अभी आप लोग रजिस्टर करेंगे या सोच रहे होंगे, क्योंकि मैंने यहाँ से बहुत कुछ सीखा है। तो सबसे पहले तो मैं अपने तीनों फैकल्टीज को थैंक्स बोलती हूँ, क्योंकि उनका जो एनलाइटमेंट है, पहले मुझे लगता था कि कोर्स ज्वाइन करने से पहले कि अरे वही सारी चीजें होंगी, वही मटीरिया मेडिका, वही रेपर्टरी, बट जो मैंने यहाँ सीखा वो जैसे अभी सर लोग कह रहे थे, आउट ऑफ द बॉक्स, हाउ टू थिंक आउट ऑफ द बॉक्स, वो बहुत सारी चीजें सीखने को मिली। क्योंकि जब हम लोग क्लिनिक पे बैठते हैं तो वहां पे सारे जितने भी MR आते हैं वो उनके सब जितने प्रोडक्ट्स हैं सब अच्छे हैं, जितने भी पेशेंट आते हैं वो सब गूगल करके आते हैं, तो वो भी सब सीखे होते हैं। तो वी हैव टू बिहेव इन आवर क्लिनिक्स, हाउ वी हैव टू बी अपडेटेड, वो चीजें सर लोगों ने सिखाई। व्हाट वी हैव टू कैच होम्योपैथिकली, स्पेशली इन अ होम्योपैथिक प्रैक्टिस, बहुत सारी चीजें, जैसे अभी सर ने बताया आर्ट और साइंस दोनों हैं, तो वो कैसे अप्लाई करना है, वेयर इज आर्ट एंड वेयर इज साइंस, वो चीजें सर लोग बहुत अच्छी बताते हैं, जिससे मुझे जो फायदा हुआ, एक तो मैं पहले 200 1M से ज्यादा मैं प्रेस्क्राइब नहीं करती थी। 1M वॉज माई लास्ट पोटेंसी व्हाट आई प्रैक्टिस्ड अर्लियर, बट जो मैंने सर लोग के केसेस देखे, फिर स्टडी किया, जैसे सर लोगों ने बताया कि नहीं, डोंट गो बिहाइंड अस, यू रीड, यू जस्ट चेक कि आर यू गेटिंग दैट थिंग इन योर पेशेंट और नॉट। तो वो मैंने चीजें पढ़ी, समझा, क्यों सर बोलते हैं ऐसे 10M देने को, कहाँ सर बोलते नहीं 30 दे के छोड़ दो, तो क्यों बोलते हैं, वो चीजें सीखी मैंने। एंड सबसे बड़ी बात कि कैसे मटीरिया मेडिका पढ़ी जाती है, वो एक अपने आप में बहुत बड़ी आर्ट है। फॉर एग्जाम्पल, मैं अपना एक केस आपको बताऊंगी जो बहुत ही मेरे लिए भी बहुत अजूबा था। एक बच्ची मेरे पास 12-13 साल की आई, एंड शी वॉज ब्रॉट अप बाई हर गार्जियंस, उसके ताऊजी यहाँ कानपुर में रहते हैं, एंड शी वॉज फ्रॉम आजमगढ़। एंड वो आई और उसका एक नी पूरा स्वेल्ड, इट वॉज अबाउट 4 times मच स्वेल्ड फ्रॉम द नॉर्मल वन, राइट साइड का, लेफ्ट साइड वॉज स्वेल्ड अप। एंड उसके गार्जियंस मेरे को कहते हैं कि डॉक्टर साहब इनको PGI दिखा चुके हैं, दैट इज लखनऊ KGMC, एंड इनको एम्स दिखा चुके हैं, सब जगह से इनका ट्रीटमेंट हो गया, बट कोई फायदा नहीं हो रहा है। और अंत में PGI में इसकी बायोप्सी तक हो गई कि कैंसर तो नहीं है या कोई ऐसी डिजीज तो नहीं है, लेकिन कुछ भी नहीं आ रहा है। मेरे 1 लाख रुपए सिर्फ टेस्ट में चले गए। तो डॉक्टर साहब इसमें क्या करना है? सो देयर कम्स द रोल ऑफ नाइस इंस्टीट्यूट। वहां पे जैसे सर लोग बोलते हैं आउट ऑफ द बॉक्स सोचो, क्योंकि वो ट्रीटमेंट एम्स को भी दिखा चुकी है, PGI में भी दिखा चुकी है, तो ऑब्वियसली एंटी इंफ्लेमेटरी जा चुकी होगी, एंटीबायोटिक्स जा चुकी होंगी, सब कुछ हो चुका होगा। सो आई थॉट नहीं, मैं केस को अच्छे से लूंगी, और मैंने उस केस को मैंने बच्चे से पहले फ्रेंडली हुई मैं उससे, ताकि बच्चा अच्छे से बताए। एंड उसके बाद उसने मुझे बताया कि ऐसे पेन स्टार्ट हुआ। मैंने कहा अच्छा, पेन कब से स्टार्ट हुआ? शी टोल्ड मी एवरीथिंग। उसके बाद मैंने कहा अच्छा बेटा, तुम्हारे जब ये स्वेलिंग शुरू हुई, उससे पहले तुम्हारे घर में या तुम्हारे कहीं कुछ तुमने एक्टिविटी करी थी, खेलते समय गिर गई थी। तो शी सेड नहीं नहीं मैम, ऐसा कुछ नहीं था। तब तक हर फादर सेड कि ये इसने एनुअल फंक्शन में पार्टिसिपेट किया था। तो आई सेड अच्छा, तो यू डांस ऑल्सो? तो शी सेड यस। मैंने कहा अच्छा, तो कब था तुम्हारा एनुअल फंक्शन? शी सेड ऑन दिस डेट इन नवंबर। मैंने कहा प्रैक्टिस कब से स्टार्ट हुई? शी सेड 2 months ago. एंड व्हाट वाज द डांस? तो देन शी सेड कि एक 2 minutes का स्टेप था जिसमें हम लोग नील डाउन होते थे, नील डाउन होके डांस करते थे। एंड वी यूज टू हैव अ सर्कुलर रोटेशन इन दैट नील डाउन पोजीशन। तो गोल गोल घूमते थे। तो सी, वहां पे सारी ट्रीटमेंट्स हो चुके थे। देन इट केम टू अ इंजरी पार्ट, और वो एक सिंपल इंजरी थी। आई जस्ट गेव द अपनी मोस्ट famous medicine arnica, and by only arnica, after a week, with along with SL, 2 types of SL I gave to her. And after a week, क्योंकि she was from Ajamgarh, she was staying at her Tauji's place, तो I said कि ठीक है, 1 हफ्ते बाद इसको लेके आई, I want to see the change. तो आफ्टर 1 week she came to me very happily कि मैम पता है मैं आज मार्केटिंग करके आई। तो मैंने कहा अच्छा, खुद से? तो बोली यस, अलोंग विद माय ताई जी, एंड अलोंग विद वॉकिंग, वी वर वॉकिंग फ्रॉम द मार्केट अप टिल योर क्लिनिक। सो दिस वाज द थिंग, एंड उसकी स्वेलिंग वाज ऑलमोस्ट नॉर्मल, ऑलमोस्ट ओनली 10% आई थिंक स्वेलिंग रह गई थी, अदरवाइज swelling was all gone. So that was the observation technique what sir taught us, and that thing helped me how to observe, how to listen, what to give, what not to give. ये भी देते, ये भी देते, ऐसा नहीं है, जो है टू द पर्टिकुलर। एंड बहुत सिंपल केसेस कभी कभी बहुत ओवरलैप होके आते हैं कि ये भी ऐसा भी हो गया, वैसा भी हो गया, बैप्सी भी हो गई, बट वहां पे वी हैव टू बी वेरी पेशेंट, वेरी काम, एंड वी हैव टू लिसन वेरी in a different way, in a very keen manner, like sir showed us that video. So like how we go, हम लोग जैसे शॉपिंग पे जाते हैं, अगर रेंडमली चले जाएं तो कुछ भी उठा के लेके आ जाते हैं, बट अगर हमने लिस्ट बनाई है और वो लिस्ट लेके हम शॉपिंग करने जाते हैं, तो हम टू द पॉइंट वही सामान लेते हैं जो हमें लेना है और लेके चले आते हैं, बट हमें पता होना चाहिए कि हमें किस शॉप पे जाना है। तो दैट इज द थिंग व्हाट वी लर्न इन नाइस इंस्टीट्यूट, एंड व्हाट आई हैव लर्न। और वो एक रास्ता सही जाना, that intuition has to be created, that sensibility has to be created for a correct homeopathic practitioner. So thank you all of you, and thank you all faculties, and hope, and I wish all the best to the prospecting students of NICE Institute, that they will also fly with all the blooming colors of our rainbow. Thank you.
Thank you very much, Dr. Neha, for sharing your experience.
So here I want to say one word.
Yes, sir.
All our super faculties, coordinators, so all that, they're all started their journey as a student here. From first batch to last previous batch, all they started. So now after that, they are a part of an institute. Same thing I am expecting from this batch also. So who knows, tomorrow you will be the faculty of this NICE. Okay, so who are all, these people also joined as students. They showed the interest, commitment. Now see, they are in the teaching side. So I wish from this batch also we get अच्छे हीरे उबल कर आए. And I wish all the best for you.
Search diamond from the dust. So that is not dust. That is a group of diamonds. So pick up the diamonds. Okay.
So we are all diamonds. All we need is a little
Yeah,
bit
that's what
of
meaning.
sharpening and finishing, you know.
Ah.
So before we end our session for today, for the next 5 to 10 minutes, we will take up any questions. You all can put it in the chat box or raise your hand. So we will take it up one by one. Any questions related to the course? Please, no personal cases queries, that we can take it as in how the sessions continue. Any queries related to the course, you all can ask now, either in the chat box or you can raise your hand. And another thing is, today there are few participants who haven't registered yet. So after this session is over, you all can touch base with any of our coordinators and register as soon as possible. So let the learning journey continue, and we should look forward that all of us are best clinicians. So any queries?
Not only queries, any suggestions, any remarks you wanted to this thing, please. So you can
Yes.
unmute your this thing and you can talk. Questions is fine. That is also there. Otherwise, also you want to share, you want to talk, you want some remarks or suggestions, also welcome. Okay. So my sir used to always say, if there is no question, there are two things. Either they know everything or nothing. Huh?
Yeah, they know everything now. They know everything. Yeah, they know everything.
I've put in the details about our institute, about the phone numbers of our coordinators. You all can touch base with any one of them. I don't see anybody raising hand or having any queries. So let me, okay, so let me end this. Thank you everyone for patient hearing and attending this session. As mentioned by Dr. Shilpa, Dr. Swami sir, Dr. Hegde sir, Dr. Patel said that in the next few months, we are going to enhance our clinical knowledge and make appropriate use of the knowledge that we gained into 5.5 years of our college life. Remember, friends, that we are here all to grow together, to swim and race together, and to be good clinicians or practitioners, and doing justice to both our patients as well as our system of medicine, homeopathy. As our faculties mentioned, that even after the course is over, the journey doesn't end here. Our faculties, coordinators will always be there to guide you all in any of the cases or any hurdles or challenges that you all face in your clinical practice. So we are always here to enlighten you all, to guide you all, to mentor you all throughout your clinic life. And thank you, Dr. Neha, for sharing your experience and your personal growth as a practitioner in the field of homeopathy. As mentioned, all those who haven't registered yet can kindly get in touch with our coordinators. The details are shared in the chat box. You can also visit our website, that is www.nicehomeopathy.com. Our email is pgnice2020@gmail.com. We look forward to sharing knowledge and spreading homeopathy and being a part of post-graduation diploma in Advanced Classical Homeopathy Batch 7 with all of you. Thank you very much for being for attending today's session. Thank you, dear faculties. Thank you, coordinators.
Shubhadin.
Yeah.
And we request your feedback in the group of today's session. Thank you, Dr. Trupti, for moderating the entire program.
Thank you, one and all.
Thank you to all of you. Thank you very much.
Thank you. Dr. Shilpa, you can end the session for all.
Yeah.